Hello and welcome to Positive Talk. We still continue with our issue that we're focusing on last week, an issue that is not only seizing Zimbabwe but the rest of the world, issues of non-communicable diseases, and our special focus has been on breast cancer. We're still going to have one breast cancer survivor sharing their story, and then the next two segments we're going to be joined by a medical expert, Dr. Edwin Mguti, who's going to really enlighten us as Zimbabweans to then say, yes, we are witnessing an increase in issues of breast cancer, cancers in general, other NCDs. What do we need to do to protect ourselves? And on the program now, I'm joined by Mrs. Faris Takawira. She's a breast cancer survivor, like I said. Welcome to Positive Talk.
Thank you, Tariro. Hello.
We want you to share with us your journey. Kuti muzoti muzoziva kuti I've got breast cancer. What happened? What did you do? How are you surviving now?
Okay. It all started in 2008 when I noticed a lump on my breast and on the armpit. I had read about breast cancer, and when I saw the lump, immediately I knew that there's something wrong. I quickly went to a friend doctor. She told me to go straight to World Woman Clinic and get tested for breast cancer. So that's when I went to World Woman Clinic, and they did their tests and they referred me further to have that lump removed so that they could see if it was a cancerous lump. Both the lump on the underarm and the one on my breast. So in March 2008, I went for the lumpectomy, and immediately, I think in 4 days, the results came out. The surgeon told me that it was breast cancer, stage 3. I went to the doctor with my husband, so my husband remained outside when I went in. So as soon as the doctor told me that it was breast cancer, I said, let me call my husband. My husband came in and he was told the news. I think for me it impacted on him more than with me. So we were referred to the cancer center for counseling before anything else. So I went to the cancer center and met with Sister Agatha, who counseled me. She told me she was 18 years survivor. So that gave me a lot of hope and faith that this can be cured, or I can go through this. And so I went for the mastectomy in May, in March, and in April I started the chemotherapy. Yeah, that was the most difficult time. The 6 months that I went through chemotherapy were very difficult. You know how chemo is, the loss of hair, and you know you can't go to where places are gathered because your immune system is suppressed and you can catch up any infection. So it was like you just have to stay at home and go for chemo, stay at home. But I thank God I managed it.
What would you say inspires you? Because from 2008, and for me when you said stage 3, because we often hear it's stage 4, I know Dr. Mguti is going to clarify that for us. But for me, stage 3, it's a bit late. But you managed to be treated, and here you are, 12, almost 10 years later. You are still here, healthy. How did you survive?
It's only the grace of God. It's only the grace of God, because during that time, I also had, like you were saying, stage 2. I also had stage 2 friends whom I was doing chemo with, who are no longer with us. So that's why I say it's just the grace of God.
The community. Last week we heard from some who were talking about there's an element of stigmatization. People still don't understand. How are you coping with the community? How are you also encouraging other people to actually go for screening? Because from everything, what we are learning is early detection is important.
Yeah, the community, I think for me, it was, I got a lot of support, even from my neighbors, from the neighborhood, because immediately after the diagnosis, I told everyone. I didn't hide. My family, my relatives, the community, the church, everyone was very supportive. Even the workplace, they really supported me. Yeah.
Then when we're looking at issues of treatment, how easy was it for you? We heard one person last week saying for some services she had to go to South Africa. It's also costly. For you, how was it?
It was a difficult period for us as a family. And you know, 2008 was a difficult year for everyone in Zimbabwe. And the medication was not easily accessible. We had to source our own medication. It was very difficult, but we just thank God that we managed, we sailed, we managed to get all the medication and everything that was done. Unfortunately, I couldn't do radiotherapy because that particular time, each time you would go for radiation, the machine would break down after maybe 3 treatments. And then after that, you have to wait for it. They say the doctors are coming from, was it Germany, to fix the machines. And then once, I think after 3 weeks, and then you have to go back again. So I said, no, I can't do this. I can say that cancer treatment in Zimbabwe is very, very expensive. And for me, when I look at it, we only have 2 centers of treatment. That's Bulawayo and Harare. We are also lobbying and crying. Can this be decentralized? Because you find women coming from far, and some cannot even afford. That's why you find most women don't even want to have those diagnoses, because what then after that? Because they can't access the treatment. Yeah, that's our cry.
So what message would you like to give to Zimbabweans regarding the importance of them knowing their bodies, them to be able to detect any change, any major change that happens to their bodies?
Yeah, it's something that we as Zimbabweans don't take seriously. Because you know, when I told people that I had a lump, they would just say it will just disappear. Don't worry about it. And people are not educated about these diseases, especially with breast cancer, cervical cancer, and other cancers. People always think that once you're diagnosed with cancer, that's your death sentence. You know, you are like, tomorrow you're going to die. But only God knows when one will die. But yeah, I think people need to know, to be educated. Because even right now as we are talking, if you ask women if do they examine themselves, they don't. Nobody does. It's only a few who do that. Yeah, so we have a group of breast cancer survivors. We are opting for that. So we are lobbying for all that, the awareness and things like that. So yeah, I think we'll get there. Yeah.
Well, join us after the break. I don't even need to reinforce the importance of us knowing our bodies. That self-examination that we always hear about, we are constantly being reminded. But what is lacking is the taking action. I think from today onwards, this has to be a routine in our lives. Join us after the break when Dr. Mguti is going to be clarifying to us. She is saying she has been cured. And for me, the question that I have is, can breast cancer be cured? Can other cancers be cured? He is going to clarify all that for us. Join us. Welcome back. We continue with our program, and like I promised, we are now joined by Dr. Edwin Mguti. He is former Minister of Health here in Zimbabwe. He is a consultant surgeon. He is also the founder of breast clinic at Pararenyatwa Hospital. So he has quite a lot of experience when it comes to issues of breast cancer. What we want to find out from him as Zimbabweans, and I'm sure these are the questions that we have. Breast cancer, can it be treated? How early do I need to go to them? issues of staging that we were hearing last week and even this week in our first segment. He is going to be elaborating all that for us. Dr. Mgutu, welcome to Positive Talk.
Thank you very much for inviting me.
We want to find out breast cancer in Zimbabwe. Statistics are shocking, and it's showing that it's increasing. Or is it increasing, or there's awareness? I want to first establish that from you.
Well, I think we are seeing it more and more. And as you correctly say, when you see a condition more and more, it's either it's increasing or it's being detected more and more. People are more aware. So you can have a disease in the community and people are not aware of it and you won't know. So I think right now with the awareness campaigns that have been taking place, more and more people are coming. So you can say, yes, on our records it's increasing, but that does not equate to an absolute increase in the incidence of the disease in the community. Mm-hmm.
Then a lot of women were coming and they were saying, I detected, when I went, it was detected at stage 3. One was saying stage 4, stage 2. Women would want to know, what is this staging? What does it mean for me if I come to you and you are telling me you are stage 3, you are stage 2?
Yeah, I would like to say those are more technical issues, more to do with the quantification of the disease and how extensive it is and how far down the line it is. So stage 1 is the earliest form, stage 2 is a little bit later, stage 3. Stage 4 is the worst form of the disease. But for the women out there, the community in general, I shouldn't want to worry them too much with the technical details because it's a guide for us, the clinicians.
As medical practitioners.
Yeah, because if we...
So why do you tell us then?
Just for general information. But the problem now is people will then go to Google and they see horrendous pictures. So sometimes we limit the amount of information we give. It's a delicate balance. Some people want more information, others want less. But basically, stage 1 is more likely to be cured than stage 3 and 4. Mm-hmm. However, each one of the stages has got a treatment protocol which is attached to it, which is appropriate for it. So basically, if you have stage 1, a simple operation to remove the lump can be curative. Stage 2 as well. Stage 3, you then need surgery plus chemotherapy with or without radiotherapy. Mm-hmm. Yeah. So those stages, they are mainly for the clinicians. And I don't believe that clinicians should give out too much information which would have the effect of scaring away the patient. Yeah, and it's also quite devastating. And the person is told you are stage 4, or what does it mean to you? You know what I mean? So I think clinicians have to be careful how much information they give, and not necessarily to hide information, but to give it in a more humane and progressive manner. Yeah.
So for a start, as a woman, for me now, I'm thinking, if it's going to come to me, then I need to come to you and it's stage 1. What are the steps that women need to do for you to then say, I'm detecting? Yes, we are celebrating October Breast Cancer Awareness Month. There is that awareness that we are creating. But what exactly are we telling women to do? Totangira papi chiremba.
The most important thing is for the women and men as well, because men also get breast cancer, is to be vigilant. Yeah, be conscious. Their health-seeking behavior should be conscious. They should not wait if they detect any abnormality whatsoever. Even if it's not a cancer, it's better to go to the relevant clinician to get checked out and you are declared to be free from the condition than to wait. Procrastination is the biggest problem that we see in society. And it's not only associated with the poor and the lowly educated. No, we've seen highly educated people with PhDs coming late because there are a lot of psychological issues as well. People are scared, they're terrified of the possible diagnosis of cancer. So because of that, some will opt to stay in a cocoon, and hope for the best. Yeah, so I think awareness campaigns and counseling services, people should know what services are available, where to access them, and they should be accessed easily so that, people can benefit better. Yeah. Mm-hmm.
But on me, on my body, on my breast, what do I need to do? I want to hear it from you now.
First of all, you need to know about your family history, because there is a family association in breast cancer. It's not very common, but it's there. So if you have any relatives, blood relatives, not your husband or but your blood relatives who have had breast cancer, or who have had any other cancer for that matter, prostate cancer, stomach cancer, any cancer, that puts you in a higher risk of cancer in general. Okay? So if you know your family history, and you know that there's somebody who has had cancer in your family, you should make moves to get checked out. Okay, number one. Number two, be self-conscious. There are a lot of cyclical changes that happen to the woman's body throughout the monthly cycle. Okay, so breasts do change in configuration and texture throughout the month. So you should be familiar with your own breast. How do they feel? If you detect any change whatsoever, it doesn't have to be a lump necessarily. The lump is the most common, but it can be a change in how you feel about them, how they look, whether there's an itch or a lump, any change whatsoever, any deviation from the normal, you should go and get checked out. And your clinical evaluation consists of the clinician will talk to you, then they will examine your breasts, and they will try to detect any abnormalities. Then further to that, there are tests that can be done which will detect problems which may not necessarily be detectable by simple examination. So we have ultrasound scan, we have mammography. These are special x-rays which are taken of the breast, and they are able to identify any suspicious areas. When we say suspicious, we mean an area which we think could be cancerous. If that is detected, we then take a small piece of tissue, we're using a needle, from that particular area, which we submit to the lab, the histology lab. They will look at the cells, the structure of the cells, and tell us whether it's cancer or not. If it's a cancer, what grade is it, etc., etc.
Well, you have heard it. I think from last week, what we're talking about, when we're talking about breast cancer, it was the issue of the lump. But the doctor has even told us, "Anza lump chet, kune zvimwe zvinhu zvinogona kungoitika, any abnormality pama breast edu." So as men, as women, let's be conscious about that. Join us after the break. Welcome back. We continue with our discussion where we are looking at issues of breast cancer, and in this segment we also try and touch on some NCDs that we are witnessing as Zimbabweans. But Chiremba, apa ndiri kuda kuti mbotitsanangurira nyaya yenzvimbo dzekunorapwa. Maitakawira first segment vachema breast cancer survivor. Hanzi cancer irungorapwa uparinyatwa nekublawa yochete. Chokwadi here. Kana chiri chokwadi sei zvakadaro.
That is basically true. Ichokwadi. Cancer treatment treatment is highly specialized. Haingoni kuitwa kuma smaller institutions because of the nature of the condition and the nature of the treatment facilities that have to be there, the drugs used, the radiation and all those. It cannot be too decentralized, but I do agree that it can be decentralized, at least to provincial level, yes. But for you to successfully decentralize it, you need the personnel, which means the doctors and nurses who are fully trained and able to diagnose and treat the condition.
We have them in Zimbabwe.
We do, but maybe not enough. And also maybe the distribution is not appropriate, because there tends to be people congregating in Harare who have what I would call a misdistribution, a maldistribution, a skewed distribution, whereby most of our patients are out there and most of the clinicians are in the city. But there are many social factors that cause that to happen. Yeah. So while this decentralization is good, I would start off by, first of all, strengthening the services available at the central hospitals. to really bring them up to the highest standard possible, and then gradually decentralize to the provincial hospitals. Because mind you, she talked about radiation and chemo. Radiation is very toxic, and it's a double-edged sword. It can cure disease, it can also cause disease. So you have to really have sophisticated institutions, which I do believe can be decentralized, at least to the provinces, to make it available closer to the people. But it's not just a question of saying, we have a facility. The facility has to be supported, in terms of all its requirements. Yeah, the diagnostic services, maintenance, make sure the drugs are available all the time, etc., etc. Because a cancer patient who has started chemotherapy cannot afford to break and say, Nasa kuna next week. You know what I mean? You got to maintain the treatment cycle. You have to be faithful to the treatment cycle until you complete it. If you break, then it means you start afresh, the cancer gets resistant, or it becomes even more aggressive, you see now.
Safely as a country, can we say if I go to Harare Hospital, no, to Parenyata Hospital, to Bulawayo, I guess it's United Bulawayo Hospital, I can access all the services?
I can't say we are up to the standard that we would want to be. You can get a lot of the services, most of them, but the services are overwhelmed by the numbers, because these are two centers catering for a population of 14-16 million people, and there are also some issues related to the general poor state of the economy. Okay, but what I can assure you is we do have the necessary personnel to be able to handle most cancers, if not all. Yeah, we don't have to send our patients anywhere for treatment. We just need to improve our infrastructure and our services in general.
Then lastly, Chiremba, nyaya cancers in general, non-communicable diseases in general. Chachi kafere, because vanhu vari kuvhunza zveshuwa. Wakungonzwa ningi, prostate cancer, afa. Uyu, pazonzi cancer yechakati. Macancer angonyuka. It's almost like angonyuka from nowhere. Ndo zvangozara iye zvino. Takungonzwa vanhu vese vakungofa necancer. Mungambotitsanangurirai papa kuti chii chakunyatsoitika chaizvo.
Yeah, that's a very interesting and very complicated question. I will try to answer it as much as I can. It's multifactorial. There have been so many changes in the demographics of the country, in the living conditions. Yeah, the food we eat has also changed over the generations. I can tell you that I have a few relatives who are more than 100 years old, and they are not exposed to the stresses that were exposed in town. Cars spewing out fumes, people are now smoking when they never used to smoke. Alcohol, the diet has also changed. Yeah, you have people wanting to go braying, and you consume a huge amount of meat over a short space of time. Your body is not designed for that. Yeah, so I can't be specific and say it's because of ABC, but definitely lifestyle changes have had an effect on this upsurge in cancers. Some studies were done in the past where they looked at Japanese people that emigrated to the United States after the Second World War. And it was seen that they started to adopt or to acquire the diseases that were never common in Japan simply by moving over to the United States. So the question was, but why? It's the environment, you see? So we have to modify our environment and make sure that any known causes of cancer, we should try to avoid them by as much as possible. Yeah. Why should people smoke, for example? Why should people consume an excessive amount of alcohol? Our parents and the grandparents, they never used to do that. Yes. So that's the answer I can give. That applies even to diabetes, high blood pressure, blah, 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 all these things. Yeah.
Well, you heard it, Zimbabwe. I know this is a question that we have had so many times and people are asking and they'll continue asking, but I think the doctor has done a lot of justice. Our lifestyles. We really have to take care of ourselves, watch what we eat, exercise, do everything that we know is good for our health.
Gango is nice, I know. I also love Gango. But if it's damaging our borders, why are we doing this? So let's think about what we are doing ourselves, limit some of these things, enjoy them. But anything that is enjoyed to excess is not good anymore. And then also another thing, let's be supportive of our community members. If we hear somebody's not feeling well, let's just find out. Even Memu family, you heard Dr. Muguti saying, sometimes it's because of your family history. And from there, we can learn and save lives. Like I said last week, Zimbabwe, let's share the information. Let's save lives. Let's build a better Zimbabwe.